My first thought when they told me that I had cancer, the first thing I said to them was, I have 3 little girls. I can't have cancer. I have 3 little girls. I was very active, going to the gym probably 6 days a week, and in really good shape. I was getting pretty strong, which is what I want to be. And my back and shoulder started to hurt, and I thought I had hurt myself, either lifting weights or doing something at the gym, and nothing was relieving the pain, and quickly it got bad. I couldn't sit comfortably, I couldn't lay comfortably, and I was exhausted because I wasn't sleeping. And so they did a CT scan. They brought me back a little while later, and they told me that I had cancer.
The outside institution requested a transfer of her care to Mayo Clinic because they felt that she would need a multidisciplinary effort to coordinate her care with surgeons, radiation oncology, and medical oncology. The tumor had actually destroyed multiple areas of the bone. At T5, 25% of the bone had been destroyed, and at T8, which was the more concerning level, close to 80% of the bone was gone in the vertebral body, and she had developed a pathologic fracture at that level with angulation of the spine.
Once I got to Mayo Clinic and I met with Dr. Buchanan, my neurosurgeon, he biopsied a part of the tumor on my spine, and we found out that it was pancreatic neuroendocrine tumor, which is a type of neuroendocrine cancer.
The spinal cord was at risk for injury, and which can lead to permanent paralysis. So Dr. Buchanan had to make a decision. We need to do something, but I just need a little bit more background on this cancer and what the patient can expect in terms of recovery. How quickly does the patient need to start treatment?
Once I reviewed her imaging and I had a discussion with Lorie, and I explained the precarious situation that she was in, and we had a discussion with the oncology teams, both radiation and medical oncology, and we all agreed that we needed to proceed with surgery as the first step, with the explicit understanding being that she would need adjuvant therapies, including radiation and chemotherapy.
Having the expertise, the ability for one physician to pick up the phone and speak to an expert and a specialist and to get real-time recommendations, I think that's very unique to Mayo.
Dr. Starr said to me at one of my first appointment, he said, I know this sounds scary, and I know everything seems like your world's crashing down and it's the end of the world, but I will get you to a point that you're gonna wake up and you're just gonna be living life like you were before.
I think as physicians, we all go into this profession because we want to help people, and I think an important part of helping patients is getting them back to a good quality of life, and quality of life means different things to different people. So when you plan a surgery and when you interact with a patient, I think the goals of care have to be in line with what quality of life means for them. And in her case, she thrives from being in the outdoor, and that's really what she wanted to accomplish.
You don't want to live every day thinking about the fact that you have cancer. People wouldn't know if they didn't know me, what I was dealing with. And, I have kids with me all the time, and I want them to see their mom as their mom. That was one of the promises that I made to them, was that, no, I'm still your mom, You're not losing me. I'm still here. I'll be okay. There's things that I have to do. There's doctor's appointments I have to go to. There's medicines that I'm gonna have to take. There's therapies that I'm gonna have to endure. But I'm still your mom, and I'll still be the one that takes care of you. When you're sick, I'm there. When you have a thing at school, I'm there.
In many ways, the key to Lorie's success is really Lorie. And I think Mayo Clinic is certainly there to support her. I think she has access to the best care available on earth, really.
Everybody's journey with a diagnosis like this is very unique to them. Mayo is at the forefront of these research efforts so that we have better treatment options so patients can live better and longer and live fulfilling lives. She's doing all the heavy lifting, and we're cheering her on.
this as somebody with currently incurable cancer. It's nice to know that Mayo Clinic's working towards finding either other treatments that will continue to work for me or a cure. Wouldn't that be nice? Every little girl needs their mama. Forever.